All right. So, how do you get rid of eye floaters? And what options do you have for eye floaters treatment? Today, we're going to be talking about everything that has to do with eye floaters, including what eye floaters are, what causes eye floaters, when it's an absolute emergency, what sort of symptoms are happening to you that you absolutely should call a doctor right away. And then we'll talk about the different treatment options that your doctors may be able to offer you, whether it be a surgical treatment or a medical or maybe even a vitamin option that's available right now. We'll even talk about some of the new research that has come out in the last year about future treatments that I know when I've talked with other doctors, they haven't even read this research. So it's going to be exciting. And what I really want to hear from you, I think, is first, how long have you had floaters? Because myself, I've had them since I was in my early 20s. And that's a big deal when it comes to knowing how we treat floaters, is how long you've had them. So let me know in the comments what kind of floaters you've been noticing. Are they big, hairy, or are they big, hairy, the cobweb ones, or are they small little speckles that are moving around? Now, I do want to say thank you to all of our channel members because they make videos and education like this possible. So thank you very much. Now, when it comes to eye floaters, we kind of question, like, what are floaters? What are these little spots, right? We see them as these kind of drifting spots that move around side to side. Like right now in front of my computer screen, if I look left, look right, I'll see these little drifting spots back and forth. And they get really annoying, right? Again, I've had them since my early 20s. And part of that is because I'm really nearsighted. And sometimes people get these just due to age. And we'll kind of get into that. Now, we call them different things. Some people just call them floaters. Eye floaters is kind of the most common term. In the eye care world, we call them vitreous floaters, or in literature, we'll see them as symptomatic vitreous opacities, or SVOs. That's what we'll write in your your medical chart sometimes. Now, when we look inside the eye, here on the one side of the screen, that's literally a photo of what a floater looks like when we look inside the eye. And then this is a digital rendition. You can see these little dark spots behind the floaters. Those are the shadows. And that's why you see those drifting spots, because the floaters are inside the eye, casting a shadow onto the retina. Now, when you think about what floaters are, they're these pieces of collagen that are suspended in this gel inside the eye that we call the vitreous humor. Now, this vitreous humor is mostly water, about 99% water, but there's little chunks or a meshwork of collagen, hyaluronic acid, and then a proteoglycan called chondroitin sulfate. Now, we get floaters for a couple of different reasons, but the most notable cause is age. And right now, if you see here under the exhibit A, you see a scan of a fetus's eye during development at 33 weeks, and you can see how beautiful that vitreous gel looks. It is uniform. But as we get older, at age 59, under B here in this photo, you can see the strands of collagen starting to separate and some liquefaction, some almost liquid that's developing inside of the gel. And then finally, at 88 years, you can see large pockets of fluid and these strands of collagen that have separated and they've bunched up. And so when you look side to side and you see little hair-like cobweb strands, that's what you're seeing. Now, you may think you may be younger, you may be young like I am, and you're still seeing these strands and these spots. And part of that is because if you're very nearsighted, if you're myopic, you're going to be more likely to see them. And part of that is because as you become more nearsighted, your eyeball stretches. It stretches out, but the gel really doesn't move with it. And so because of that and some other factors, then you start to have this breakdown of this meshwork of collagen, fluid, and all these other parameters inside the gel. The reason why its age is connected with it has to do with oxidative stress. I have that down there. And so some of the research is looking at ways that we can slow down oxidative stress within the eye. But that leads to a breakdown and disorganization of the collagen. So part of this process of developing floaters is that this gel breaks down, but the gel is loosely attached to the retina in the back of the eye, as we have here in this picture. As this gel is attached to the retina in the back of the eye, it begins to separate. It begins to let go of its attachment to the retina, and we call that a posterior vitreous detachment. And as it pulls away, It's most densely attached to the optic nerve in the back of the eye. That's the white spot at the far end there. And when it pulls off in a big circle. And in the eye clinic, we can see that circle in the back and we call that a Weiss ring. And so if you've ever noticed a large floater, like not just little spots drifting around, but one really big, like asteroid of a floater, and you look side to side and it gets in your way, that's probably what you're seeing is that Weiss ring, that large chunk that is pulled off from the optic nerve. Now, there's a couple other symptoms that you should be aware of. Most notably are flashes of light. If you all of a sudden just noticed 100 floaters all at one time, and you see a bright flash of light, and it can be like a bright flash off in the corner of your vision, like someone took a camera flash, or like my aunt recently, she had these new flashes of light, and she described them as almost like a lightning bolt going side to side, even in her vision. It doesn't have to be straight up and down like the way we think of lightning. You can get a flash of light going side to side. And if you have any of these symptoms, especially with a darkening of your vision, like a curtain of darkness is coming down from the down from up above, or coming in from the sides, or rising up from the floor, that is a sign of emergency. That's a sign that you need to even stop this video, stop watching, call your doctor to hopefully get scheduled within the next day or two. Because that could be a sign of what we call a retinal tear or detachment. The whole process of the gel pulling off from the back of the eye, about 95% of the time, it goes by just smoothly without any problems. But there's that 5% of time where when the gel peels from the retina, it tugs a little bit on the retina like loose wallpaper and can create a small tear. And if that happens, fluid can seep behind the tear, and then it can start lifting the retina off the back of the eye. And that is a cause of concern because people can lose permanent vision and go blind from that. So again, do not wait for it. It's better to get it checked out, even just to be, have some kind of calming of your nerves to know that everything's okay. And so again, if you're seeing bright flashes of light with new floaters, new dark spots in your vision, best to go get seen sooner rather than later. Now, you're thinking, okay, we want to hear about what are treatments, what are options for floaters. Maybe you're not like that. You're not having this bright flash of light, or maybe you've already seen your doctor and they verified everything's okay, and you still have these floating spots. They're annoying you. You can't see, you can't function. They're bothering you. What can you do? So here are our options. The first option is something called a vitrectomy. This is probably the oldest solution that we've had. It's a surgical procedure where you have to go into the operating room, and usually a retina specialist will perform this procedure where they siphon off the fluid. This is a procedure that is a little bit more complicated, and I would say most surgeons don't really like to do for floaters, and we'll get into that. But looking into the more recent published research just in the last few years, there is about a 90% satisfaction rate with this procedure. The results of complications, because everyone wants to know that, and I think it's important that doctors, if you're going in to see a retina specialist or you're even just talking to your primary care doctor, the concern is, all the side effects or the complication risks. So again, recent publications show that endophthalmitis is about 1% risk. That is an infection of the eye. It's probably the most devastating ocular issue that all eye doctors fear is an infection of the eye, and we call that an endophthalmitis. It's about a 1% chance, or a little bit less. Retinal detachment occurring sometime within the next year is about 1 to 1.5, and developing a tear, swelling of the retina called macular edema, or bleeding or hemorrhage in the retina is about a 2-3% chance during that procedure. And then cataracts. So if you've never had cataract surgery before, you still have what we call your phakic lens, or a crystalline lens that you were born with. That lens will, on a third of the cases, again, this is the most recent reports, a third of the cases will develop a cataract within 12 to 16 months. So most doctors I've talked to, when they have a vitrectomy, all surgeons will just tell the patient, you're going to have cataract surgery at some point in the near future. So it says 1/3 of the cases, but realistically, you're going to develop cataracts much faster after a vitrectomy. If you've already had cataract surgery, then you're in luck. Then you don't have to really worry about that. But thankfully, cataract surgery is very simple in terms of success. It is one of the most successful surgeries that I think have ever been developed in the world of medicine, and for most people they love getting cataract surgery. I don't want to oversell it, but if you talk to most eye care providers and most people who've had cataract surgery, they have really good outcomes. Outside of vitrectomy, laser vitreolysis has been growing over the last 15, 20 years. This is a procedure where your doctor uses what's called a YAG laser, and it literally plays the Asteroids video game and shoots the floaters inside of the eye. Some of the things that's cool about it is that there is a very good 75% improvement rate in the literature, and it's typically better for solitary floaters rather than diffuse. So if you have that large PVD, that large floater in the center of your vision that keeps coming back and forth and bothering you, it's going to be a lot easier for your surgeon to hit that and remove it. But if you have a lot of small spots, small little spotty floaters that just drifting out, it's a little bit more difficult for them to clear that out 100%. So I think that's why with getting vitrectomy, you have a 90% satisfaction rate because they can remove all the floaters, where with laser vitreolysis, it's about a 75% improvement rate. And that's because they can only remove the big floaters. There's also the location of the floater, something your doctor has to think more about. If the floater's too far forward in the eye, the laser could cause it actually creates a small plasma burst inside the eye that moves anterior. And if you have an implant in the back of the eye, like implant in the eye from cataract surgery, or if you still have a phakic lens, like again, the crystalline lens you were born with, that energy could hit the lens, either cause a cataract or it could pit the implant from cataract surgery. And so your doctor doesn't want to go too far forward. And if they do go too far back, they could hit the retina. So again, they have to be very specific about where they're aiming inside the eye. Complications for laser vitreolysis are very low. In fact, they're so low, it's like 1 to 2 cases being reported of cataracts, eye pressure, glaucoma. Retinal tears, attachments, and retinal hemorrhages are also very low. And I do have some resources at the bottom of the slide, and we'll have those in the video description for any other eye care nerds out there who want to read into this. Something that's quite fascinating more recently, though, are gold nanoparticles. This was a research publication that came out in just 2021, where they tested on rabbits, but gold nanoparticles. So nanotechnology has been kind of probably in the news for like the last maybe 15, 20 years, but they used gold nanoparticles that would attach onto the collagen, these large floaters. And then they would use another type of light similar to the YAG laser, but at 1,000 times less energy. And they were able to shine it on the gold particles and it would get them to vaporize. And because they were attached to the collagen, it would vaporize the collagen and the floaters along with it. Again, this was tested in rabbit eye models, and I haven't seen any publications or research that's pursuing this still, but the fact that they've published this and it seems possible, it may be in the works. We just haven't heard about it yet. So this is something we are looking forward to, because with 1,000 less energy, 1,000 times less energy, that means it's way safer and less likely to cause any other complications like we just mentioned before. So what are other treatments? Because those are the two surgical, vitrectomy and YAG laser vitreolysis. Those are probably the two most common you'll ever hear doctors maybe mention. But there's some other research and other cool things that are available now. First off, if you've been following our channel here on Dr. Eye Health, back in 2019, I posted a video on pineapple as being a possible cure for floaters. And that was based off of this research article looking at pharmacological vitreolysis of vitreous floaters by 3 months of pineapple supplement. Now, let me know if you've watched that video already. When that study came out, it is a pilot study and it's not perfect. There's some errors in it, but it did raise an eyebrow for at least pursuing an option other than surgery. And what they were looking at was pineapple is having a protease called bromelain. And bromelain, and quoted in the research, was that it's mainly responsible for complete debridement and dissolving the overgrowth connective tissues. So they were trying to see if they could naturally give people food source of bromelain to try and hoping that this would cross the blood retinal barrier and get into the eye and start dissolving these collagen bundles of fibers, causing the eye floaters. Well, if you've watched that video or read any of the comments, I love reading it because I do get feedback. And some people have told me they've tried it and they've had success. I've had also a lot of people say that it did not help them at all. And let us know in the comments if you've eaten pineapple and noticed anything similar to those sort of results. I know for most doctors, we read that and we're thinking, okay, there's a little suspicion. It wasn't the best, most well written. It was just a pilot study. However, just in 2022, in November, we had a new publication, kind of part two, wasn't the same authors, but they did a 3-month double-blind trial and they did it in a clinical trial using basically a vitreolysis through supplement of mixed fruit enzymes for patients with ocular floaters and vitreous hemorrhage-induced floaters. And I did dug into the research a little bit more to figure out what are they meaning by mixed fruit enzymes. And it turns out they specifically were using 190 milligrams of bromelain, of a supplement of bromelain, 95 milligrams of propane, and 95 milligrams of phycin, which are basically comes out of enzymes that you find in papaya, pineapple, ginger, and kiwi. And what they ended up finding, and again, it wasn't a perfect study. There are some translation errors. This was out of Taiwan. But what they found was that after 3 months, the individuals who took higher dosages, they took up to 3 capsules, had almost a 70% improvement in their floater symptoms. I did want to call out, if you look at this graph that I have in there, this is directly from their publication. It says none at the top for how many capsules they took a day, but they did technically receive a placebo of vitamin C, which I would argue is maybe not truly a placebo. They also, when it lists 40 there at the start under before, that's before they started, that's how many eyes had floaters, not how many people had floaters. So often these people entering the study had floaters in one eye as the kind of the control floater. Not the control. They had floaters in one eye, but not floaters in the other eye. And if you look at the second month on that none line, they eventually had 43. So people eventually gained floaters in the eye that originally didn't have floaters. But then eventually it decreased again on the third month. The authors went into trying to explain or theorize of how this works. And they believe it's kind of working as a scavenging effect, or basically an it works at reducing kind of inflammation and oxidative stress within the eye. Now, again, vitamin C, I said, maybe wasn't a best choice for a placebo because as a scavenging effect of free radicals, the kind of light blue line is vitamin C. That's pretty high. It's almost the same as bromelain. But the purple line at the very top is the mixed fruit enzyme, the combination of the papain, the phycin, and bromelain. So it had almost, they argue that it could be a synergistic effect or perhaps a cumulative effect. Just to give an insight from a doctor's perspective, a lot of doctors I've talked to about these sort of research studies, we learn in school that the blood retinal barrier is very tight. There's what's called tight junctions within the eyeball on the retina, and that prevents fluid leakage from getting in from the retina, from the blood to get into the retina and potentially passing into the vitreous. So for a long time, a lot of doctors believed that it was impossible for any sort of medication or supplement to pass into the vitreous through that method. However, as more research is coming out, there seems to be maybe that was a falsity, and now we're learning a little bit more. So what else can you take? Because right now that mixed fruit enzyme is not available. Now we have this. This is a new supplement that we did a video recently about here on this channel a few months ago. This is offered through MacuHealth, which is a really well-respected eye vitamin company. They make a lot of different vitamins for the eyes, but they're pretty well-respected in the eye care world, and I have absolutely no affiliation with this company. But they did do this study it wasn't even them. It was actually an independent source that did a dietary intervention with targeted micronutrient formulation to reduce visual discomfort. I know these long names, but they're basically trying to see if this supplement could reduce symptoms of floaters. And basically what's in this supplement is this mixture of zinc, vitamin C, grapeseed extract, citrus fruit extract, and L-lysine. And in a 6-month trial, in general, they noticed a 66% improvement of symptoms. And let me know if you guys have ever had any sort of supplements for eye floaters, if you've tried these, if you've had success with it, or if your doctors have ever mentioned it. It is fairly recent, this publication. I personally want to see more research studies on it, but I think as far as safety is concerned, and if my patients ever wanted to consider trying it, as long as they just know that, there's only one study out right now, we'd like to see more. Maybe it'll work. Maybe time will tell. But if it's something that floaters are really bugging you, you don't want to go through surgery, or maybe it's not an option for you, perhaps this is an option. But as with all supplements, I do recommend you talk with your doctor to make sure they know what you're taking in case it potentially mixes with any other medication you're taking or other supplements. You can overdo supplements. And so that's why I always say, don't just take my word for it. Read the study yourself, talk to your doctor. It's going to be the best option for you. But again, I have done that video, and it goes a little bit more into depth of the findings of that research study, as well as what zinc and all the ingredients in there, how they play with the eye, and how they believe that helps with the floaters. The other really interesting research I found when I was preparing for this and looking more into floaters was just published in October of 2022 here, and this was out of China. And again, when you read some of these studies, especially when they're a foreign language that's translated into English, because English is my primary language, sometimes there's translation errors, and it's sometimes hard to read. This was, again, it was done through a research laboratory designing a functional eye dressing. And this is a topical, kind of like a treatment transdermal through the skin to treat the eye, which is really kind of something different I have never heard of somebody trying to do. And their idea was that by using oxygen and hydrogen to increase blood oxygen and fight inflammation and cell death within the eye, to kind of support the gel, not just the gel structures of the eye, but other components, potentially the retina, the sclera, all components of the eye. So very interesting. And they even broke down in the research what they used and where they got it from. I couldn't find it. I don't think it's available for public sale, but at least for research purposes, this is what was in them, using sodium hydroxide, aluminum powder, and some oxalates. But they followed 28 patients for 4 months, and they found about a 70 to 83% improvement, which, again, very small study, but rather interesting results. And so it at least raises an eyebrow for potential future research and study. But again, if you read that research yourself, and I do have that link in the description below, I question, because they didn't talk about how long per day people were using this eye dressing. They also didn't really go too in depth about complications. They listed some complications, but they didn't really break it down the most scientifically. At least, again, it could be some translation errors, but at least it's very interesting. And so maybe down the pipeline, we may even have almost like a transdermal patch that you can wear on your eyelids to help support the health of the eye, and even maybe treat floaters. Let me know if you think you would ever do like a transdermal patch on your eyelid for a few months to help remove your floaters. Now, that's really your options. With eye floater treatment, you have basically, when you see a doctor, they're going to be talking to you about your surgical treatments of having a vitrectomy, vitreolysis. And I'll be honest, most surgeons don't really like to do those procedures all that often because there is a risk. Even though the risk complications are very low, from a doctor's perspective, if your vision is still 20/20, even though you're seeing floaters, it's largely been dismissed that floaters aren't that bad. But over time, especially laser vitreolysis has gotten a lot more attention because it is a bit safer. And we know some people really struggle with these annoying floaters in your vision, right? If they start bothering you from reading, you can't drive, you don't feel safe, you can't enjoy your daily quality life, then perhaps doing these procedures may be a benefit. So outside of those things, a lot of doctors will just say, hey, sorry, get used to it. And let me know if you've heard that before. So there's a lot there. Now, I want to transition over to our Q&A because I imagine a lot of you guys have questions. I've been seeing a lot of great questions come in. with our live Q&A, I do want to first say thank you to all of our supporting members, our channel members here. We got a list of some of our channel members. Thank you so much, because that makes these sort of educational videos possible. We also, if you ever want to consider being a channel supporting member yourself, they get choices. We put out some polls to see what type of topics we want to hear covered, and they get priority if they ask a question, they get priority in these live Q&As. But otherwise, thank you again for supporting it and making worldwide education around the eyes possible. And then it's just a medical advice disclaimer. I can't give medical advice in these Q&As. I think it would be a disservice and unethical for me to give medical advice without a thorough eye examination. So I encourage you, ask your questions. I'll give it in an educational format just so that everybody can learn more about what's going on in the eye. But definitely see a local doctor about any diagnosis or getting appropriate treatment for your eyes and eye health conditions. Otherwise, yeah, I know you guys got a lot of good questions coming in. Let's see what kind of questions. If you guys want to put a question mark at the beginning and then a question mark at the end, please let me know. That'll be kind of a flag to me so I can see your questions. I know right away I see a good question from Vanessa Latour. Vanessa asks, why do eye floaters fluctuate from day to day, especially maybe when you're stressed out? So a great question, Vanessa. Thank you. So a lot of people do notice floaters kind of fluctuate, right? You may see it move from side to side. I've heard some people say that maybe it fluctuates with their blood sugars. That's something that I don't think I've ever seen in research to really conclude, but I've seen a lot of people in the comment sections of YouTube videos just anecdotally say that they've maybe noticed that. One big factor that I know does play a role is just the brightness in your setting. So people will notice the kind of the black or brown spots of their floaters more on a blue background, like a light blue sky, or maybe a white background, certainly on a computer screen, because you have that vibrant light coming straight toward you. And so that may play a role. Also, the size of your pupil. If your pupil size is really small, again, a bright computer screen, your pupils are going to be smaller, and that's going to cast a darker, more dense shadow directly onto the retina. And so you may notice them more. In fact, a potential treatment option that we didn't really discuss because it doesn't get rid of floaters is using very low dose atropine. There are a couple of publications talking about doctors prescribing low dose atropine to dilate the pupil just about 1 millimeter, and that potentially will cause a diffuse scattering of the shadow of the floaters in the back of the eye. It may at least reduce symptoms. Although it doesn't eliminate the floaters, it will maybe reduce the symptoms. It's something I've prescribed for a few patients. It does have to be compounded often. So it's a little bit more difficult to get. And I've had about a 50-50 shot. Some patients find it helpful, and I've had some patients not find it helpful at all. But really good question. As far as stressed out, it's a little difficult to say why that may be. However, I think part of it can just be anxiety. And if you're very anxious and you start seeing these spots drifting into your vision, it's easy for us to hyperfixate on a problem that you have that you're seeing all the time, especially if you're just really tense. And that could not just be for floaters. It can also be for dry eye is a common one, or really just any sort of eyelid twitch or other problems in your body. If you're having like a sore leg or a sore knee and you're anxious, maybe that pain might be amplified for you almost psychologically. So again, great question. Thank you so much. We have a lot of great questions in here. I know I see Millie Jackson. I see, does a dark vertical line classify as a floater, or is it something else? Oftentimes, floaters come in different shapes and forms, so you can see them as just small little dots, and people describe them as gnats. I personally have a mix of them, so I see the little spots, but I do also see some almost hairs, and some people have even described them as they look like amoebas or like a piece of bacteria or something like that. But they can come in cobwebs in different kind of shapes and forms. So not unlikely that if you have a dark vertical line, could be a floater. But again, always talk to your local eye care professional to have their opinion. and really kind of verify that for you. I see Billiard Bob um, asking, I have floaters. The other day, I got stuff in my eyes and it felt like I got punched very hard in the face. Oh my gosh, that sounds horrible. Is this normal? Okay. Should I avoid this in the future? It's tough to say what kind of stuff you got in your eyes. I think anytime you get anything in the eye, you do want to just make sure it gets flushed out correctly. Make sure your eyes are feeling better. And then, of course, always talk to a local healthcare professional to get it evaluated, especially if the eye burns, if it's red, if your vision's fluctuating at all. Definitely see a local healthcare professional. It stinks that you felt like you got hit in the face. I think anytime you get something on the eye and you're seeing new changes in your vision, talk to a local healthcare professional, especially if it's not improving very, very quickly. This is a good one, I think. Smokey asks, hey, I sometimes see a dark spot speck randomly appear in my vision. Do you know what it is? I also have double vision. Is that a sign of blindness? Wow, those good questions. The dark spot randomly appearing in your vision, it's tough to say what that could be. There could be many causes. Certainly in the terms of floaters, it perhaps could be one, because floaters, again, are suspended in the vitreous gel inside the eye. And so when you look left and look right, these little floaters that are suspended in the gel can drift around. And that's why sometimes you see them and then sometimes you don't. And so that potentially means that if you're seeing dark spots, that could potentially be just a floater. But again, there are other potential causes and diseases that could be leading to seeing spots. And again, that's why I think if you haven't had your eyes checked by a doctor recently or talked about this specifically with your doctor, it's good to get the eyes checked just to make sure that everything isn't something else other than floaters. Double vision, there's a lot of causes for double vision. Floaters typically don't cause it. However, as floaters peel off from the back of the eye and you develop that posterior vitreous detachment, there is kind of this theory that the gel, when it peels from the back of the eye, creates little micro tears. And this little micro tear can form a scar tissue, which we call an epiretinal membrane. And the scar tissue kind of bunches up and it becomes almost like a wrinkle in the back of the eye. In fact, another name for it is called macular pucker. And when you have this puckering, that can cause vision changes, as well as like a distortion in your vision. And that can sometimes be confused with double vision. Usually this happens monocularly with one eye, but it's something that we always screen for when people come in with new floaters. So something to have checked out again. Double vision or diplopia can be caused by many things, with the eye muscles, with the convergence or movements of the eye. And it gets really complicated, but sudden double vision, any problems with double vision is not something to be taken lightly. You do want to see a doctor about that. And again, I think it's something better to have sooner evaluated rather than later. So hopefully that helps. Thank you, Smokey. I know I see a lot of good questions coming in. JD asks, I love that, JD, because I think of JD from Scrubs. If you're a fan of Scrubs, let me know. I grew up watching that show. It says, I see floaters. There are none on the pictures of my eyes. So it sounds like you've already gone in to an eye exam and they've maybe taken a photo of the back of the eye and they didn't see any floaters. Does that mean they're not severe and you've had them for 20 years? So there are many different causes for spots in your vision. Some people do see small floaters. And from an eye care perspective, looking inside the eye, sometimes we cannot see them. They're so tiny, they're translucent. It's very difficult to see them, sometimes not just on photos, but just during an examination. And so if they are that small, again, most doctors, surgeons would say you wouldn't be a very good candidate for surgical procedures because we can't really see them. We can't verify that that's it. And so there is that, again, people who even had vitrectomy, where they fully removed all of the gel inside the eye. There's still 10% of people who aren't happy. And so there is this question, is all floaters caused by the gel inside the eye? Are they true floaters, or is it something else neurologically that people are having that they're just not like maybe there's a breakdown of communication of how the patient describes it to the doctor, and the doctor understands what the symptoms really are. But in most cases, I would say that yes, if you have floaters, symptoms of floaters, and your doctor can't see it, they're probably so small, they're not considered very severe. Hopefully that helps. But yeah, it's not uncommon to have floaters for a long time. So thank you. I see Hannah asks, can floaters cause dry eyes? No. Quick, easy one is that the floaters, because they're inside the eye, they are not related to dryness on the surface of the eye. However, if you have really dry eyes, your vision can fluctuate. And again, you may be drawn to that irritation, that blurred vision, maybe frustrated by that. And perhaps if you do have floaters along with dry eye, you may be just becoming more hyper aware of all the visual problems that you may be experiencing. But thankfully, floaters are not directly connected to dry eye disease at all. Ooh, this is another good one. I thank you for bringing this up. Ruby asks, saying that I've been getting a lot of visual aura with disorientation, no headache, like a typical migraine aura. I do get floaters when this happens as well. Could this be an eye issue? So it's a complication, but Ruby, you bring up a good point. So again, floaters, like we're talking about in this video, are vitreous floaters. These are the floating spots that are stuck within the gel of the eye. But we do experience other types of floating spots in our vision. One of these is a migraine aura, or a migraine with aura. Or the proper term is called a scintillating scotoma. And if you've ever had a migraine before, some people do have these flashing lights. They usually start off very small, and then they grow and they become like a zigzag line for some people. And it usually branches in both eyes, because it's actually occurring in the visual cortex back in the back of your head, where it's the both eyes receive signals from the back of the eye, or sorry, both eyes receive signals from the back of the brain. And so when you have that migraine starting in the visual cortex, it radiates to both eyes, and you end up seeing it in both eyes. It is possible, and there's some debate in the literature about retinal migraines and really what a retinal migraine is. And this is when you have that visual aura in just one eye. But some people confuse like the floaters like we're talking about, like vitreous floaters, with these occasional spots in the vision. So thank you again for bringing that up, because I think it's just good for people to hear that there's different spots that people can experience with their eyesight. It's good that you don't receive a headache, because that's another possibility. People can get a migraine aura without the headache. It's interesting that you notice that you do get floaters, maybe the dark spots, with the migraine aura. And again, it could just be that you're just more aware and sensitive of what's happening in eyesight. But I don't think that there is a physiological connection between the eye and noticing more floaters during a migraine aura experience. But again, if you haven't had the eyes examined in the last year, or if you're having migraines frequently, definitely again see a local eye care professional, just so again they can make sure everything's healthy. As far as James asks, with eye floaters, how come most of the time you don't see them? So again, it depends on where the floaters are located inside the eye. It depends on the size of your pupil, and sometimes it does just depend on the location. Yeah. So if the floaters are further back in the eye versus further far forward, or if they're off to the side or indirectly in front of you, those are probably the biggest things that relate to seeing the floaters. But really good question. Ariba, thank you for asking, do floaters go away with time? So the answer is yes and no. There is oftentimes a diminished experience of floaters. So if you just suddenly have a new experience of floaters, it's still best to probably have your eyes checked at some point if you're having new floaters. But over the first 6 months, people do often report, even with the first 6 weeks in my experience, people notice at least a diminishing of their floaters. And it's believed that, it used to be thought, or at least taught, that maybe floaters drift down due to gravity, or that they dissolve a little bit over time. It's true the vitreous does liquefy, and so perhaps they do diminish a little bit, but large floaters usually don't go away. They usually stay in the eye for most of the rest of your life. But a lot of people notice decreased symptoms because you neuro adapt to them. You almost just kind of get used to them being there. And so neurologically and psychologically, you're more just thinking about your day, about what needs to get done. You're thinking about what meal you're going to have this evening. You're not really focused on those floaters anymore. You just sort of live with them. You tune them out, right? So usually in the first 6 months, we notice that tuning out. But and then I should say that's one of the reasons why a lot of surgeons won't do a vitrectomy or laser vitreolysis in the first 6 to 12 months. It used to be waiting at least 6 months before doing the procedures, but oftentimes now, in a more recent publication, they recommended waiting at least 12 months after the beginning of floaters to see if they fully either resolve on their own, either just a neuroadaptation, or to just try to avoid potential further complications of a retinal tear or detachment. And so they usually recommend 6 to 12 months after developing floaters before they consider one of those procedures. So thank you so much. Hey, Ray, just want to say thank you so much. Ray got $1 in there. Thank you so much. I appreciate that. Ray actually asks, can you correct your eye stigma with surgery? So eye stigma, a lot of people will call that, say it that way, but it's properly written astigmatism. With astigmatism, this is a problem with your refractive error, and we do have a video going into astigmatism, and I've addressed this in a little bit with some videos on like LASIK. Astigmatism for most people is caused by a curvature change to the front surface of the eye. I think of it like a basketball. If you had a perfect round basketball, most people's cornea, the front surface of the eye, isn't perfectly round. Imagine a 5-year-old sitting on that basketball and it kind of squished a little bit. That's kind of the shape of the cornea for most people. And that astigmatism, that shape, causes blurred vision. Thankfully, if you're interested in surgery, there are options to correct astigmatism with LASIK or PRK. With SMILE procedure, I don't believe that they can do very high parameters. I think there's more research looking into doing SMILE to correct for astigmatism. But ICL, if you have a really high prescription, an intracolumnar lens implant, ICL has been approved, at least in the United States, for astigmatism correction now. There are certain limitations. If you have a really high amount of astigmatism, it may not be the best options for you. But thankfully, that is potentially an option. And so definitely talk to your local doctor and local surgeon about kind of your level of astigmatism. Is it stable? Are you a good candidate? As well as complications. Because again, we've talked about other videos of potential risks and complications with all forms of refractive surgery. So really good question. As far as, see, Bobby asks a good question about when the gel is removed in surgery, do you have to keep your head down for several weeks? So that's a good question. So when you have a retinal detachment, and I've done at least one other video on retinal detachment surgeries. There's different types of surgery a doctor may perform. One of those is when they put what's called a pneumatic retinopexy, but they put a type of they either put an oil or a type of gas inside of the eye, and because they want to keep the retina attached to the back of the eye, people often need to look downward, and so they do have special pillows and like almost like massage tables with like a hole in it, so that you can keep your head down for most of the day, so that air or oil bubble pushes up on the retina and holds it in place. Again, this really depends on the procedure. Usually when they do a vitrectomy, though, and they remove the gel from the back of the eye, it is a pretty complicated procedure, but usually you aren't keeping your head down for several weeks just from a vitrectomy alone. But again, it depends on the procedure and what's going on with your eye. So again, talk to your local surgeon and they'll be able to explain everything to you. So thank you. And then as far as astigmatism, I know we just had one more question here from Hello. Do astigmatism stop at any age? Astigmatism is usually something that most young children are born with, and then it starts to slow down within the first year or two of life. Then it can still change because the eye as a biological tissue can still grow, morph, and change. But it usually doesn't change as much as other parts of your refractive error. The astigmatism can be complicated or worsened by people rubbing their eye, and that leading to a condition called keratoconus, um, which is a little bit outside of this discussion of this video. But it astigmatism generally does slow down after the first few years of life. It can still progress and even change, especially as you get older, because the lens inside of the eye, a cataract, or the crystalline lens, can start to age and slowly form a cataract. And with the cataract formation, the shape of the lens inside the eye changes, and that can induce astigmatism. For example, myself, the surface of my eye is relatively perfectly spherical. It's like 42 all the way around. Um, uh, with that, it means all of the astigmatism I have in my correction for glasses and contacts comes because the lens shape inside of my eye is kind of wonky, and that creates astigmatism. Just to kind of give you a little bit more insight. Now, I think this might be my last question for this evening. Again, coming from Vanessa. Have I personally tried anything to help my floaters? Eating pineapple, for example. I personally haven't really tried anything too hardcore myself. I'm interested in maybe seeing what these the new vitreous floater vitamin that has come out in the last year. I'm thinking maybe at least picking that up and seeing how I respond to it. My floaters, thankfully, I've adapted to, and they're pretty small. I don't have a large Weiss ring or PVD yet, so I personally am not bothered by it. But thank you for asking. There are some days I think I notice it more than others, but again, I think it has to do with my pupil size and what I'm doing that day. So thank you guys so much for being here and being part of this education. If you want to know more about eyes, eye floaters, surgical treatments, or if you're concerned about having a retinal detachment, make sure you do see a local eye care professional, have that checked out. But if you want to learn more about how those surgeries go along, I'll put that video up here in a video so that you can click and watch that. Again, thank you guys so much for being here. Have a great day.